Augusta Health and the Valley Community Services Board are bracing for the impact of Medicaid cuts. Chris Graham and Crystal Graham here, and yeah, the those two local healthcare entities are bracing for potential substantial cuts to Medicaid and Medicare from the so-called Big Beautiful Bill passed by the House of Representatives. Crystal, you reached out to the folks at Augusta Health and the Valley Community Services Board. What are they talking about? What's the latest?
Well, I mean, I think, of course, the hope is that the U.S. Senate will not move forward with these potentially very deep cuts to Medicaid over a 10-year period, potentially more than $700 billion cut from Medicaid, 500 billion from Medicare, and 367 billion from the Supplemental Nutrition Assistance Program, which most people know as SNAP. So obviously hitting those who struggle the most, and if these cuts move forward. So you can imagine, Chris, when I chatted with Valley Community Services Board, the fear is that, you take these kinds of things away from people. You make it harder for them to stay on Medicaid if they're on there already, and people could end up potentially in jails, right, or homeless as a result of these kinds of things. So, there have been a lot of people at the national level saying, this is going to lead to people dying if they move forward with these kinds of deep cuts. Augusta Health basically put out a statement regarding this that just said they understand the need for fiscal responsibility, but they do not believe the path forward is cutting $715 billion from the Medicaid program. And of course, that provides essential health care coverage to America's most vulnerable population. And Mary Mannix, who is the Augusta Health president and CEO, basically said that would result in diminished coverage and access to health care for the vulnerable neighbors, and it would shift a financial burden to those in need of care to the states as well as America's hospitals. There have been a lot of talk, Chris, at the national level more than the local level, that if these cuts are made, that a lot of rural hospitals and smaller treatment facilities may shut down as a result, because of course, if those Medicaid payments aren't coming through, or if people aren't eligible for them, they can't shoulder that cost themselves.
Yeah, because people still get sick and they still have to go to the hospital. I mean, it's obviously best if you have health coverage, health insurance coverage, and you can go to a doctor first. But if you can't afford to go to a doctor, the folks who can't afford end up going to an emergency room where the care is a lot more expensive. And somebody's got to pay for that. And it ends up being the hospital, and then thus us, the rest of us too. And it's not casting any aspersions on anybody who is in a situation where, I mean, there's still 20 million people in this country who still don't even have health care insurance, even with the Affordable Care Act being in place. And so let's throw 10 more million people off and see what happens. It may not be our local hospital, Augusta Health, I mean, because we're in a relatively decent sized region. Augusta County, Stanton, Waynesboro, combined population of around 125,000. But I mean, just down to our south, Rockbridge County, in the Lexington Rockbridge Natural Bridge area, I would worry about that hospital. I would worry about hospitals between us and Roanoke, and then from Roanoke to Bristol. On the 29 corridor between Charlottesville and Lynchburg, between Lynchburg and Danville. I would worry about the smaller medical centers and hospitals in those kinds of areas. Southside Virginia, Crystal, your family, your at least part of your family's from the Emporia area down in 95 near between Petersburg and the Carolina border. I would worry about people in areas like that those hospitals, which are probably already operating on a very, very tight budget, you lose access to these Medicaid and Medicare dollars. It's not going to be good.
Yeah, Chris, I also talked not just about hospitals, but, to Valley Community Services Board, which really addresses the mental health, behavioral health, substance abuse issues of people in the community. And, they said, I believe that 70% of their budget comes from 70% of their clients are on Medicaid, and 50% of their revenue comes from Medicaid. So that's a potential. She said she did some rough numbers and said that's about $6 million per year that could be cut. Now, she doesn't anticipate that even if this moves forward, that all the cuts will be made in year one, right? It might be over the course of that 10-year period that they're talking about, but that's still a very substantial amount of cuts. And unfortunately, that would likely mean workforce cuts, right? And so, as more people would be pouring into Valley Community Services Board, because if they're going to a private care facility, they may no longer be able to go to them if they no longer have insurance. And so they would go to Valley Community Services Board because they're state mandated to provide the care, right? And so as a result of that, they would have more people coming through their doors and unfortunately less people to serve them. And so that would lead to longer wait times and things of that nature, especially for group therapy, individual therapy, things of that nature that are typically part of what you get when you go to a community services board. Again, I talked with Kimberly McClanahan, who is the executive director there, and she says it's not going to be a pretty sight if these cuts do come to fruition. And she said, but here's the deal. They're going to be transparent with their employees. It's going to be none of this nonsense where you come in for work on Thursday and you're given a pink slip, right? They're going to try to give their employees as much notice as possible and be as visible as possible as they learn more about these cuts. And again, like I said, everybody's kind of holding out hope that Senate Republicans will not just fall in line with the House Republicans' votes because it was pretty much a party line vote, that they'll push back against these Medicaid cuts.
I feel like the quick read I've been able to do, it feels like it's the Senate Republicans have a 6 vote majority, 53-47, but only 3 of those, actually 4, if you take away the potential tiebreaker from JD Vance, the vice president, only 4 need to cross party lines to make changes. I feel like that's an easily attainable number. I don't know that anything close to resembling this House bill is going to ultimately be the bill that gets to the president's desk. But that said, the Senate's going to do its magic over the next couple of months. They'll have to go back to the House. The bill will, and I've been harping on for our local readers here in the 6th district of Virginia. Ben Klein voted proudly for this bill last week. He said these reforms protect the program for those it was intended to serve. Claims that it takes away health care are simply not accurate. These charges apply only to those who aren't eligible under federal law. MAGA Republicans like Ben Klein are trying to make this out to be that illegal immigrants, undocumented immigrants, are the whole cause of this. The
Right,
issues in healthcare.
yeah, you're not wrong, Chris. That's exactly what they're trying to do. But the reality of what they're going to do is make it harder for people to call in, right? Because they're going to reduce the number of people that are answering phones. And so if you're stuck waiting on the phone for 6 hours to get somebody on the phone, right? How many people are going to hang up? And as a result of that, their coverage could lapse. They're also going to make it where instead of having to check in once a year for eligibility, basically, you would be required to do that twice a year. Again, with longer phone lines. And then if you're meeting in person, they're shutting down some of the offices. So you might have to travel further, which again, if you're already stretched and don't have a lot of funds, can you afford that extra gas money? Do you have transportation to get to these further locations? So a lot of what they're planning to do over these 10 years is make it more difficult for the people who are on Medicaid to stay on Medicaid, having to jump through all these additional hoops and things of that nature. And then, like you said, remove the any potential people who are in the country illegally. If they're on there, they want to kick them off. They want to make sure basically they're getting no benefits, whether it's SNAP or Medicaid or anything else. So it is a challenge. I will say I talked to Kimberly McClanahan again about this, and on a personal note, she shared some of her personal opinions outside of her role at Valley Community Services Board, and she said, she really thinks that people don't understand that the Affordable Care Act, where they get their insurance, is the same thing as Obamacare. So somebody might say, I'm against Obamacare, yet their insurance is through the Affordable Care Act. They don't realize that they're really one and the same thing, right? She also said, she doesn't think that people voted for these Medicaid cuts. There's this, you've written about this many, many times, but, Donald Trump thinks that he got the majority of the vote and this is what America wants, right? But, and maybe if you listen to some of his speeches or you read Project 2025, you might have known that he was talking about cuts to Medicaid and Medicare, though, you know, people didn't vote for that. She shared that it's her opinion, that people voted for cheaper eggs, right? They didn't vote to have their insurance taken away from them.
I got an email from a reader this afternoon, not long before we hit record on our videos here and podcast here, from a person who said, "Well, sixth district voters, where we are,
Mhm.
voted overwhelmingly for Ben Klein. They voted overwhelmingly for Donald Trump, and now they're getting what they asked for." And my response back was this: okay, one, yeah. Two-thirds of our district voted for Ben Klein, and two-thirds of our district, and this district goes from the Roanoke Salem area up to the Winchester area, so it's a long district up and down the 81 corridor in Virginia. And yet, yeah, they voted for the MAGA agenda. One-third of us didn't, and that's a lot of people. I mean, the average congressional district in this country is roughly 700,000 people. So if a third of us didn't vote for that, that's about 250,000 of us didn't vote for that. And even those other two-thirds, I wonder now how many of those people wish they hadn't voted in the way they did because things are being taken away from them now. I'm not willing to give up. There's a lot of people who have the opinion of, I'm going to use the acronym FAFO, F around and find out. Um, it's real life. It's real
Yeah.
life,
Well,
and
and
we can't give up on people.
yeah, another thing McClanahan said, of course, is that sometimes we don't really understand the impact of something until it affects us, right? But, not to give up the fight because in this case, she wants people, again, this is something that would affect her and Valley Community Services Board directly. But the idea behind that whole concept is that we should care about the most vulnerable in our community and people who have this attitude of serving others, right? Who've made that their mission. Then they're going to care about everybody in the community, whether it directly affects them or not. And so she's kind of asking people to have that perspective, to realize that even if this doesn't affect you directly, do you want insurance taken away from people in your community that maybe do need it? Um, you know, Basically, it's this concept of we all deserve good care regardless of how much money we have or anything else. We all deserve care. And so I guess both Augusta Health and Valley Community Services Board, as you said in the beginning, Chris, they're bracing for what happens and hoping for the best.
Hey, and it may not, you may not think it'll impact you, but okay, so I said I think Augusta Health will be fine, no matter what, because of the size of our community, if nothing else. But what if it isn't? And then all of a sudden, we don't have Augusta Health anymore. We don't have a local hospital anymore. There are going to be a
Mhm.
lot of communities up and down the 81 corridor, the 29 corridor, the 95 corridor in Virginia that are not going to have healthcare access because their hospitals, if this passes in its form, which I don't think it will, but if it passes in its current form, a lot of hospitals are going to be on the margins and on the wrong side of the margins. So you may be in good shape now, and you may have health insurance, but if you don't have a hospital to go to take advantage of your health insurance, that health insurance isn't going to do you any good. So
Yeah.
yes, look out for yourself, but look out for everybody else, and it actually will help yourself too. Just soapbox. So
Yeah, no, and yeah, and just the last thing, Chris, is you have a voice, right? I mean, that's one thing that we chatted about when I was chatting with Kimberly is that you have a voice. You can contact your legislators. You can attend peaceful protest. You can do these things to make sure that your voice on this issue is heard. But the worst thing you can do is say nothing. And these Republican lawmakers might think that it's just okay, that you're okay with the direction that things are going. So you have to let them know that it's not okay, and you have to speak up and use your voice.
I would suggest also getting in touch with Mark Warner and Tim Kaine. This bill is now headed to the Senate. So even though they've expressed that they're going to fight, still get in touch with them, let them know how you think, and then yeah, and then when it gets back to the House, for people who live in our direct area, the sixth district, but I know we also have readers in the Charlottesville and Central Virginia area, the fifth district, John McGuire, the congressman over there, the freshman congressman over there. Let him know. Let them know that these are basic human rights, and you expect things to move in the right direction. So
And
we'll
just as a way to wrap this up, Chris, the president has said that he would like to see this, whatever, this big, beautiful bill, as you said, this budget bill on his desk by July 4th. Um, Probably won't happen. Not saying absolutely won't happen, but the way that this whole process works is the House approved their version of the budget bill. Like you said, it goes to the Senate. The Senate can make revisions, do basically line item edits to that, or they can just create their own. bill, right? So they can start their own bill, and then these basically two groups, they get together a certain number of people from each, and they kind of work on a compromise bill, and then both groups have to vote on it again. So it's kind of a long process, and if the Senate does what it says it might do, which is start from scratch, then we may be dealing with a more lengthy process than the president would like.
July 4th is 5 weeks away. That ain't happening. Let's just say that now. But great way to wrap this up. Continued coverage. Both, we'll cover the macro level, the federal level, and then the very important local level as well. Great work, Crystal Graham. Thank you for your time and your insight on that.